Bobby B. Jones was born on April 8, 1984. Currently, he is 35 years old. He is 6'2" and weighs about 240 pounds. Bobby was born in Kalamazoo, Michigan, and he is currently married to Sarah Jones, and they currently live in Florida. Bobby's father was diagnosed with lung cancer at 55, and he occasionally smoked. His mother had high cholesterol and was obese. He has no history of allergies, but Bobby has been wearing contacts since 10th grade, and he currently has 20/30 vision in both of his eyes. He shows a little bit of signs of high blood pressure, but overall he is physically fit. When he decided to go to the doctor, he was experiencing shortness of breath, wheezing, fever, and enlarged lymph nodes.
The first medical professional that Bobby came in contact with was an internist. He first went to the internist because he was experiencing shortness of breath, wheezing, fever, and enlarged lymph nodes. The internist applied scientific knowledge to diagnose a treatment plan. Internists also specialize in health promotion and disease prevention. The internist prescribed him with ibuprofen. He was to take 2 pills every 4 to 6 hours to reduce the swollen lymph nodes and fever. While at the internist, they also ran a blood test to evaluate how well Bobby's organs were working, diagnose diseases and conditions, and to find out whether he has risk factors for heart disease. Through the blood test, they determined that he has low lymphocyte levels, which can occur after a cold or another infection, and he should take ibuprofen to get rid of cold.
The second medical professional that Bobby saw was a dermatologist. He went to the dermatologist because he has skin patches, itching, and sore joints. The dermatologist noted that Bobby does have fair skin and a moderate amount of freckles. He does not have any abnormal moles on his body, but the rash that he is concerned about is dark red with spots of pink. The dermatologist specializes in treating skin, hair, and nails. Some skin conditions include acne, psoriasis, and skin cancer. Dermatologists also carry out skin grafts, laser treatments, and more. The dermatologist conducted a skin punch biopsy, which is a sensitive and specific diagnostic test for damage as a reduction in nerve fiber density, which allows for the diagnosis of small fiber neuropathy. As determined through the test, Bobby shows signs of small fiber neuropathy and has shown symptoms of skin irritations on his arms and hands. They recommend to give Bobby some steroids for the rash he has on his hands and arms, along with him possibly seeing a neurologist if he wants to.
Months later, Bobby visited an optometrist. He had symptoms of blurry eyes and he had a hard time focusing on things. He had 20/30 in his right eye and 20/50 in his left eye. Even though his vision is getting slightly worse, it is not of concern of the optometrist. An optometrist specializes in eye and vision care. They perform eye exams, diagnose, treat diseases, prescribe medication, and perform eye surgery. They can also write a prescription for glasses and contacts. At the optometrist's office, they conducted 2 tests. One was the refraction test, where they put different lenses in front of your eyes to determine what prescription you might need. Second was the slit lamp exam, which allows you to see the structure of your eye, like the cornea, iris, lens, and conjunctiva. This test can tell if you have any eye disease like cataracts. The results of the test show that Bobby does in fact have a cataract and that needs to be treated. They also show that he still needs contacts or glasses because he has a negative 1.75 prescription in his eyes.
Bobby's cataract surgery was scheduled for February 5th of 2019. In a cataract surgery, the lens inside your eye that has become cloudy is removed and replaced with an artificial lens to restore clear vision. The procedure typically is performed on an outpatient basis and does not require an overnight stay in a hospital or other care faculty.
Early in the year, Bobby went into stat care with severe chest pain, wheezing, and the feeling of a heavy chest. The doctor there recommended that Bobby sees a radiologist because of the severe chest pain he's experiencing. The severe chest pain concerned the doctor at StatCare because of the wheezing and heavy chest that came with it.
Lastly, Bobby visited a radiologist. Bobby had reported that he had a hard time breathing, rapid heartbeat, fatigue, feelings of congestion, and he was coughing up blood. The radiologist specializes in diagnosing and treating injuries and diseases using medical imaging procedures like X-rays, MRIs, PET, and CT scans. While Bobby was at the radiologist, they conducted a chest X-ray, which produces images of the heart, lungs, airways, blood vessels, and the bones of the spine and chest. An X-ray is a non-invasive medical test that helps physicians diagnose and treat medical conditions. It was determined through the X-ray that Bobby has pulmonary fibrosis caused by sarcoidosis. It was estimated that he has had this disease for about 1 year. Bobby has a rare and severe form of sarcoidosis that has never been treated before. They feel it would be best for him and his family to consider a lung transplantation within the next month or so if he would like to recover.
This is a diagram of Bobby's body before he had severe sarcoidosis. As you can see, his lungs are clear of debris. Here is Bobby's body when he has severe sarcoidosis. The yellow clay represents the sarcoidosis overtaking his lungs.
Bobby and his family decided to fill out the forms for a lung transplant. They were put on a waiting list and waited patiently for Bobby to receive new lungs. Unfortunately, help was too far away. After about 1 month, Bobby sadly passed away because of sarcoidosis. The doctors recommended that Bobby's family get tested for early signs of sarcoidosis so the disease does not get as severe in them as it did with Bobby.
Sarcoidosis is also known as sarcoid. It is a condition where cells in your body clump together to make small lumps called granulomas. These granulomas can develop in any part of your body, but are most commonly found in the lungs and lymph glands. When lots of granulomas develop in one area, they begin to affect how well that part of your body works, which causes symptoms. Around 40 cases per 100,000 people per year that get sarcoidosis, and the mortality rate is 3.9% and 9.0% at 5 and 10 years, respectively. Although the environmental trigger or triggers are yet to be identified, race and family history of disease are the most strongly identified risk factors, supporting the notion that a genetic susceptibility of sarcoidosis exists. The risk for developing sarcoidosis has been associated with certain genes located on chromosome 6 that govern immune system functions and are also involved in autoimmune disease and in rejection of transplanted organs. Symptoms of sarcoidosis include, but are not limited to, shortness of breath, cough that won't go away, reddish bumps or patches on the skin or under the skin, enlarged lymph glands in the chest and around the lungs that produce cough and shortness of breath, fever, weight loss, fatigue, night sweats, general feeling of ill health, red and teary eyes or blurred vision, swollen and painful joints, enlarged lymph glands in the neck, armpits, and groin, nasal stiffness and hoarse voice. Lastly, pain in the hands, feet, or any other bony area due to the formation of cysts in bones.
For the final treatment options for Bobby Jones, we had a lung transplantation or to take corticosteroids. A lung transplantation is the replacement of a diseased lung with a healthy donor lung. This is used to treat severe lung sarcoidosis. The corticosteroids can reduce the signs and symptoms of inflammatory conditions and also suppress your immune system, which can help control conditions in which your immune system mistakenly attacks its own tissues. We went with a lung transplant because Bobby's sarcoidosis was too severe to be taken care of by medications. In the past, he has taken corticosteroids for other illnesses, and it did not seem to help his condition. We feel it would be more beneficial to his health to find a donor.